And I'm going to have one last question. You've been very generous. I think this is a record number of questions that you've answered from my experience in GC. But I have one more question. I'm going to give the honor to microphone number 4.
Thank you. Minister Philpott, thanks for taking the time. At the Assembly of First Nations meeting in Niagara this past summer, 150 First Nations were represented by leadership with Carolyn Bennett, and they presented a plan for health transformation. At the Health Committee meeting, I know that they reached out and said they want to transform care in their communities. I know that's a complex project. The CMA and delegates here have obviously shown commitment and excitement for being part of that change. I know it's a multi-minister effort. Have you reached out to Minister Bennett in order to start to coordinate your 2 offices? And will you help the CMA lead the change in Indigenous health for 2017?
Thank you for a great question. Is that Alika? I can't quite see. Yes, okay. Nice to see you from a distance. You know what, Dr. Bennett and I don't know whether Dr. Bennett is in the room or not. She may be, because I know she's coming into town this afternoon as well. She and I talk about Indigenous health all the time. You know, the leadership around this is going to come from people like yourselves. It's going to come from folks at Assembly of First Nations. It's going to come from the Inuit leadership organizations, the Métis National Council. But we absolutely will be part of that and work on that. And as you know, the First Nations Inuit Health Branch falls within my jurisdiction. I have said repeatedly that if I can't see that I have in my tenure made contributions to improvement of Indigenous health, then I will consider my work a failure. There is a whole bunch that can be done. I have learned more than you might imagine in the last 9 months about what the realities are on the ground, and I really look forward to working with you on that.